And just on that point, so I know in my local trust, the West Herts Hospital Trust, they've done a fabulous job of creating virtual wards during COVID and have helped many patients in the work that they've done by enabling them to be at home but still be monitored and be safe. And I believe even an app was used to help sort of take certain readings throughout the day to check in on them. What's the plans for expanding that sort of virtual ward and the use of digital in enabling the patient experience really to be improved over the coming months and years? If I could come to you, Sir Simon, but I saw Amanda's nodding her head as well, if I could come to her afterwards as well.
Yeah, well, look, Dean, you're quite right. And in fact, I've been to Watford Hospital to see the work that has been led there. They are one of the early adopters of that home-based monitoring for COVID patients. And in fact, the clinicians who've driven that change there are now helping drive that nationally across the country. So a fantastic example of innovation at Watford. And we are going to see much more of that in other areas, such as monitoring of heart conditions at home. And so our NHS digital unit is, over the course of the next year, going to be taking the example of COVID monitoring and deploying that into cardiovascular monitoring. And the same is true for a number of other conditions as well.
Amanda, would you like to add in on that as well?
Thank you. So just, I mean, I would just agree entirely with your point on this. There is huge clinical enthusiasm about going further. We're thinking about things like virtual wards and home monitoring. And it is, for me, another fantastic example actually about why integration can be so powerful, because this is really bringing together primary care and their expertise, the experts that we've got in secondary care around specific conditions, the patients themselves being much more able to be in control of their own care. And of course, that digital wraparound is the thing that enables it. And certainly where we've had some really good conversations with the CQC already, it's really about how they then bring that really invaluable patient safety and patient experience lens to this and really help us make sure that we've got the governance in place to do this well across the whole country.